This is Thomas from Train Fully. If you are struggling with hip issues, whether you're experiencing pain that's affecting your quality of life or decreased mobility that's affecting your performance, this video is for you because I'm showing you in this video part of the routine that I use with pro golfers to improve their hip range of motion prior to playing. This will improve your hip mobility immediately, and if you're experiencing pain, will take your pain away and get you back to normal life. All right, so we're going to start with two assessments. They are both for your hip, and they both test your hip internal rotation. The reason we're doing two assessments is because each one identifies different possible restrictions in and around your hip. Now, I also should note that these are not the ideal way for us to do these assessments. These are passive range of motion tests, which means they should be done by a trained professional. That being said, they do give us a lot of information that we can use when planning our intervention. All right, so this is the prone hip internal rotation test. We will have you film this so that you can take a look at the video afterwards and set your camera up so that it's at about the same angle that mine is now. We'll get you down on your stomach. We're going to bend your left knee. We'll start on your left side, so bend your left knee. And without letting your pelvis rotate at all, let gravity take your left foot. Okay, so I'm not actively pulling my foot down. I'm just letting gravity take it. And I'm not allowing my pelvis to come along for the ride. I'm keeping my pelvis in neutral alignment. What we're looking for is between 40 and 50 degrees of hip internal rotation. And of course, we will test both sides. Now, when you view the video, not only are you looking to see if you have normal range of motion, but are both sides symmetrical? That's also very important. You want to have the same range of motion on each hip. Now, if you do have a decrease in hip internal rotation in this assessment, the most likely culprits are a tight piriformis muscle and tight posterior fibers of your hip capsule. We'll put that aside for now and move on to the next assessment. This is the supine 90-90 hip internal rotation test. Now, this one, if you film this, you will get a false sense of range of motion. From this angle, it makes it look like you have a great deal of hip internal rotation. So filming this one is a little more challenging. It's probably best just to eyeball it yourself while you're assessing. Okay, now if you have somebody to help you with this, that would be even better. But if not, I'll show you how to do it yourself. What you're going to do is we'll start on our left hip. We'll flex it to 90 degrees. We have our knee flexed at 90 degrees. I'm going to reach up and stabilize my knee here with my opposite hand, grab my lower leg and internally rotate my hip and eyeball that. Is that between 40 and 50 degrees? And of course, I'll do both sides, stabilize here, rotate here between 40 and 50. But what does this test tell us? All right, so if you have a decreased hip internal rotation with the supine 90-90 test, that probably means that your TFL and gluteus minimus muscles are tight. Now, this is where things get interesting because those two muscles, they internally rotate your hip. But when they become tight, they decrease your hip internal rotation. And the reason for that is because they displace the hip joint. So the hip is a ball and socket joint, and when those two muscles become tight, they pull the femoral head or the ball forward and up inside the socket. And now the surfaces of the ball and socket don't line up correctly. They can't move past each other properly. This increases wear and tear on the joint and reduces your range of motion, especially internal rotation. Now, as a result of the femoral head being pulled forward and up, the hip capsule tightens up behind and below. So we get tight posterior and inferior fibers of the hip capsule. So what I'm going to show you now is the routine or part of the routine that I use with pro golfers to prepare their hips prior to them playing. All right, so this is a self-administered mobilization technique for the hip joint. If you had decreased hip internal rotation with the prone test, that would suggest that the posterior fibers of your hip capsule are tight. Whereas if you had decreased hip internal rotation with the supine 90-90 test, that would suggest that the posterior and inferior fibers of your hip capsule are tight. Either way, what I'm going to show you here will stretch out those tight fibers of your hip capsule, which will then realign the hip appropriately, restore normal arthrokinematics and range of motion. And if you're having pain, this can take your pain away as well. So I have a green monster band anchored around this pole here. I'm going to demonstrate on my right hip. So I'm going to step inside with my right foot. And I'm going to get the band up as high as it will go, so right into the bikini area. And I'm going to get out on my hands and knees so that there's a good amount of tension pulling on that band. So the band here is providing a lateral distraction. It's pulling the femoral head or the ball away from the socket, which is then stretching out the tight fibers of the hip capsule. So once I'm in this position here, what I'm going to do is simply oscillate back and forth at 1 to 2 oscillations per second for 30 seconds. So again, this is stretching out the tight fibers of the hip capsule, helping restore normal alignment and arthrokinematics in the hip joint, which will improve your range of motion, which will improve your performance. And if you're experiencing pain, this can help take your pain away as well. Now, I can progress this though. So once I've done 30 seconds of 1 to 2 oscillations per second, I'm going to maintain this lateral distraction, maintain my neutral alignment. So I'm not allowing the band to pull me towards the pole at all. And I'm going to drop my hips back towards my heels, again, maintaining neutral alignment. So now I'm combining an osteokinematic motion, this is hip flexion, with the arthrokinematic motion, which is the lateral distraction. So this is a progression. If you experience pain with this, what you can do is just stay within your pain-free range of motion. Just bump up against your pain and then come back to neutral. And eventually your range of motion will improve. So again, we do 30 seconds of 1 to 2 oscillations per second, and then 10 to 15 flexion extension cycles, staying within a pain-free range of motion. All right, there you have it. That's what I do with pro golfers before they play. We do an assessment to see if they have full hip and turn rotation. If there's a restriction, we inhibit and stretch the appropriate muscles. Then we use a mobilization technique to stretch out those tight fibers of the hip capsule. We do a lateral distraction with 1 to 2 oscillations per second for 30 seconds, and then we maintain that lateral distraction and perform 10 to 15 flexion extension cycles. If you need help with this, feel free to contact me. And as always, I hope you enjoyed this video. Thank you for watching.